Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In this episode, we're going to be discussing a medication known as Valacyclovir. Its brand name is Valtrex. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find the information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We're going to start by talking about how Valacyclovir works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Valacyclovir. Then we'll talk about examples of dosing, and stick around till the end where we'll talk about side effects with percentages. So how does Valacyclovir work? Well, Valacyclovir is rapidly converted to acyclovir and then eventually to acyclovir triphosphate. Acyclovir triphosphate inhibits replication of herpes viral DNA by competitive inhibition of viral DNA polymerase, the incorporation and termination of growing viral DNA chains, and inactivation of viral DNA polymerase. In terms of indications or reasons we would prescribe Valacyclovir to a patient, we would generally see this medication prescribed in genitals herpes simplex. We see it prescribed in herpes labialis, as well as herpes zoster, and in varicella. Now, in terms of contraindications or reasons we would not be able to prescribe this medication, mainly it would be if a patient had a clinically significant hypersensitivity, such as anaphylaxis, to valacyclovir, acyclovir, or any other component of the formulation. Now, what about dosing with valacyclovir? So in genital herpes simplex, the initial episode would be treated with 1 gram orally twice daily for 10 days, and it's most effective when it's started within 48 hours of signs and symptoms. If it was a recurrent episode, we may see 500 milligrams orally twice daily for 3 days, and again, this time starting within 24 hours of the onset of signs and symptoms. For herpes zoster or shingles, we would see 1 gram orally 3 times daily for 7 days, starting within 48 hours of rash onset. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using valacyclovir, so I'll go over some of those here now. 8% of patients may experience a rash, and abdominal pain comes in between 1 and 11%. Nausea would happen between 5 and 15% of the time, and less than 1 to 6% of patients may experience vomiting. A headache may happen 13 to 38% of the time, and fatigue comes in at 8%. Now, some more rare but serious side effects would be aseptic meningitis or a seizure. That's all we're going to talk about today with Valacyclovir or Valtrex. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. For today, take care.